Good evening, everyone. Today we are here with Siddharth, who is a functional medicine practitioner who has joined us here from Bangalore. Thank you, Siddharth, for coming.
Thank you for having me here, sir.
Siddharth is a functional medicine health coach who has been trained from the USA. He's been in this functional medicine for a long time and he's helped a lot of patients achieve their health goals. I understand Siddharth is also a yoga practitioner of many years. Can you please tell us a little bit about how your yoga journey started and how it ended up being a functional medicine health coach?
See, when I look back, I realize that even as a child, I was very interested in spirituality. Like as a 7, 8 year old, if my father is discussing something like that with his friend, I'll be like, like listening to him as a statue. And then when I stepped out of my house for higher studies, which actually I did my MBA, that's when I started looking seriously to learn something. And 21 years plus now that I've been practicing, and I've also actually trained Isha Hatha Yoga teacher, and I taught full time for a few years actually. From 2003 till 2013, I was working in the corporate world and doing my yoga practices and some amount of volunteering alongside. 2013, I decided that although I'm making good money, but I'm not really enjoying. That fulfillment is missing basically, and my heart is actually in health, well-being, and also spirituality. So I decided I'm not going to do where my heart is not there. I won't do that for the rest of my life for sure. I used to joke with my wife. I used to say that, if I keep doing this, I'll definitely die 10 years before my time.
Corporate world is a cruel world out there.
That it is, yes.
So, you're probably not long off the mark in terms of the numbers, what you're telling. It shortens your lifespan big time.
Correct.
So you are a yoga practitioner as well now. How this interest in functional nutrition and becoming a health coach?
I still remember again, when I started working, even those days, when I'm free and I have free time, I'll sit on the internet and I'll read what's happening in the healthcare. So it's just that life took me in the direction of MBA and all, but my passion was always here. When I started teaching yoga, I realized a lot of people come to yoga because they have health problems. And yoga can solve some problems, but not all for sure. Many people are identified and they say, no, it will solve everything. That's not been my experience. Certain types of problems, yes, it can do wonders for. But there are other types of problems where you need other modalities, other approaches as well. So that's when I started looking for what more can I do, what more can I learn. Initially, in fact, I thought of naturopathy, but then I came across functional medicine and I realized this is something which really speaks to me. It resonates with me.
So, what are the kind of patients you normally help with?
So largely we are working with women. I run this program called the Hormone Reset Program along with my partner Dr. Karthikeyan, focused on women. We also work with men and children, but largely focused on women. We work with men and children because they bring their husbands and children and the family members once they feel better. We started with focusing on hormones, but what has happened is in the last 2-3 years, there's been an upsurge in interest in autoimmunity. Probably the numbers have also increased significantly for some reasons, and people are looking for help. It turns out that women are more susceptible to autoimmune disorders also. So naturally, our focus shifted in that direction because women started coming and asking for help for those problems. So autoimmunity has been the main focus for us. All kinds of autoimmune health issues. It could be simple Hashimoto's, thyroiditis, a lot of skin issues, eczema, psoriasis, lichen planus, vitiligo, or even neurodegenerative disorders, multiple sclerosis, Alzheimer's we worked with. So all kinds of issues.
So what sort of template do you follow when you see a patient with an autoimmune problem?
So I will say, we follow the functional medicine approach, which is essentially always an effort to find out the root cause of the problem, right?
Yeah.
To whatever extent, trying to go as deep as possible for you, right? Given the constraints that we have in terms of lab work that's available in India. So that's what we follow. We start with a very thorough kind of taking of history, symptoms, what all treatments they have done, their lifestyle choices. And based on that, we recommend what tests they need to do. Once they give us the reports, we process all of this information, come to a working understanding of what seem to be the major drivers or root causes for them and create a treatment plan based on. And for the next few months, our team will handhold the person in terms of implementing the plan. Very close interaction on a regular basis as needed. There are few like a pre-scheduled consultation calls, but on WhatsApp, they are people are chatting with the team or like almost every day. I must say very often we have results that kind of go beyond what we had expected.
Which is all very fulfilling and
Absolutely. I'm probably not making as much money as I was making the corporate world, right? But the amount of satisfaction I have is something else completely.
Can you share a few examples of some excellent results in some very tough cases?
So one, we had a closing consultation call for somebody just 2 days back, Friday, and this lady had come to us with the uveitis, inflammation,
Yeah.
autoimmune disorder of the eye,
Yeah.
severe pain, redness, swelling.
Both eyes.
Yes, both
Okay.
eyes. And other issues as well, migraine and gut issues, etc. And 3 months later, she's saying, I don't have any symptoms.
Back pain, gut, everything solved.
I mean, her major challenge was eyes because, see, what happens is gut issues and all know we have this tendency of ignoring them.
Mm-hmm.
ठीक है, little bit up and down, hey, it's okay, we will, manage with it, live with it. But the problem with the eyes is something which scares you,
Mm-hmm.
right?
Absolutely.
I can't lose my eyes, right?
Mhm.
Like that sense. So the eye problem was the biggest issue for her, and it's almost 100% gone.
So in this particular case, the eye manifestation of uveitis and the gut-related issue and probably the back pain or whatever she had, they were all having the same underlying root cause.
100%. What we have realized is that, I will say, at least in our experience, okay, I'm not saying this is true for everybody, but in our experience, 80% of the problem of autoimmunity is starting in your gut.
Mhm.
If you are able to address that, a lot of the problem simply resolves on its own. You don't have to do anything symptomatic also.
Mhm.
Like for her, we hardly did anything for her eyes actually.
Absolutely.
She was anyways doing whatever medication was
Mhm.
needed to,
Mhm.
keep the symptoms under control. But we just focus on the fundamentals. Speaking about the gut, because as I'm saying, 80% of the problem in my experience comes from there. Two things that I have found. One is stomach acid. Unfortunately or fortunately, I haven't come across too many other functional medicine practitioners also focusing enough of that on that. So what I've realized is that a large proportion of the patients who come to us with these issues, who alongside are showing an substantial gut-related issues also, very often the problem starts with stomach acid.
You mean low stomach acid?
Low stomach acid,
Yes.
hypochlorhydria.
Yes.
And the problem is that very often the symptoms of low stomach acid are often the same, right?
Yes.
It shows up as acid reflux,
Yes.
heartburn,
Yes.
GERD, right? All of that. And people treat it by taking antacids,
Antacids,
which
making it
actually
worse.
making it worse.
Yes.
Now, what happens, and this is, helping people understand who are watching, probably watch this video later on. You don't digest your food fully
Yes.
when you have low stomach acid. Undigested food is a disaster because the inside your body, it's always peak summer in terms of temperature, right? Body temperature, 38 degrees or thereabouts, right? Food will, if I was to leave some cooked food here on the table during summer time when the room temperature is high, within a few hours it spoils, right? The same thing is happening inside the body much faster, right? So essentially, food that is not digested fully cannot get absorbed, which means higher chances of the food going bad in the body. What does it mean when we say food went bad? We are talking about bacterial action. So we know that there is a microbiome in the gut, trillions of bacteria and various organisms live there. This is a very delicate balance, right? If they overgrow, it's a problem. If they are downregulated, it's a problem, right? And your immune system maintains that balance very, very, strictly. In this condition, what happens is they're getting food many times more than they were supposed to get.
They're actually getting the right food, but not digested. So it looks to them it's more. Had it been digested properly at the right pH, then it would have been.
Your body would have absorbed it, right? So think of it like this: you eat your meal in your plate, and little scraps are left. They were supposed to get that much because your body was supposed to digest and absorb the maximum amount. But now that is not happening.
Yes.
So they are feeding on half the food, right?
Yes.
So they start multiplying. That is the first step of dysbiosis. And then we forget often that 70% of the immune system is found in the lining of your gut. Right? Immediately when it sees the overgrowth, it starts
producing NK cells and other things.
all those things, right? I'm trying to avoid using technical terms,
Yes.
but essentially it gets upregulated. Right?
Yes.
Over-aggressive in layman terms.
That's right.
What is the definition of autoimmunity? An over-aggressive immune system which is out of control. So this is the starting point for a vast majority of people. You address that, you hardly have anything to do about the immune system. It will anyway settle down. So that's one thing. And the other thing that I found working very well again is focus on liver function and health. Even though for most people the liver numbers in the blood test, LFT test, might be within the normal range. But what happens is if there is risk biases, like all this that we are discussing, or if they have insulin resistance, right, or if they have been on drugs, medicines for a long period of time, liver function and health tends to get compromised. Right, dysbiosis directly impacts it because the toxins that the bacteria are producing, the liver tries to filter it out. But the amount of toxins coming is so high that liver is not able to get rid of it. Right, so that the liver becomes toxic. Insulin, anyways, means fatty liver will happen. Right, so essentially, what I've realized is focusing on cleaning up the liver and supporting the liver in improving its functioning goes a long way in improving overall function and health of the body.
And that is also by using a good nutraceutical support, a good probiotic and a prebiotic support.
Yes, absolutely. So, in terms of, I mean, apart from the basic B complex or vitamin D, which might be low and therefore we have to supplement, our focus is on actually using some simple, herbs, etc., for liver function and uh, things like, some probiotics. Initially, more focus on cleaning up, right? So we use products like oregano oil, peppermint oil, or some herbal combinations, and later on, kind of repopulating the gut with healthy or friendly bacteria. So really simple, like fundamental work, right?
Yes.
No, nothing exotic till now, but the good thing is that it's making a difference, and that's what matters.
Excellent. Talk a little bit on the heavy metal toxicity and the EMF toxicity in the current day and age. How do these toxins get into the system, and how are we actually looking at, or how are you actually detoxifying the body as of now? In addition to what we have already discussed.
So, sir, interestingly, you brought up this topic. Even in the context of autoimmunity, we are finding there is a disproportionately higher role of heavy metals and other toxins. Conventional thought is that only if it goes beyond a certain level, it is toxic. But there is enough research now to say that that may not really be accurate. Even low levels are toxic. And there's some very interesting study which was done on animals where they figured out what is called the NEL level, no effect level. Like if this much mercury is there in the body, there is no symptom.
Yes.
There is no change. So they figured out the NEL levels for mercury and lead. First they put, let's say, mercury, NEL level. No effect, no symptoms they could spot. Then what they did was they introduced lead into the body at 5% of the NEL level, 1/20th. So can you guess what symptoms would have shown up?
It affected the mercury level, NEL level, did it?
In terms of symptoms, what might have happened?
At 5% of a.
The second toxin introduced at 5% of the NEL level. Not only that, all the animals had some symptoms, all of them died.
Oh.
So, low level toxicity, especially when multiple toxins are present, is huge. And once again, the toxicity studies are also that are done is done on one toxin at a time. But we are not exposed to one toxin today.
Yes,
correct.
Exactly.
In umbilical cord blood, they're finding
so many nanoplastics.
Correct.
They're finding that.
You name it, it's there, right? So toxicity is playing a huge role. And a couple of years back, when we started testing most of our patients for heavy metals, we realized almost 80% of people have high levels. I will say unacceptable levels. And around a quarter had very high levels, which were above the so-called reference range also. So that is when we started looking, more deeply into it and started seeing, okay, what can we do? Because we work online, right? So we don't call patients to our center to do IV chelation, that we cannot do. So we looked at various options. We started using oral DMSA and EDT, which work, but then what happened is two things. The absorption is pretty low, right? Because the stomach acid will denature them, then the liver will try to filter it out. And also, what we realized is a lot of our patients, as I was saying, right, they have gut issues already. Those issues are getting aggravated.
Yes.
So then we came across these rectal suppositories, which we started importing from America. EDTA, DMSA, and glutathione, actually, and also in combinations.
Okay.
So they have been working very well for us.
Excellent.
Because they're safe and they don't have to go anywhere, and also much cheaper than other forms of chelation. So that has been working very well. We have before and after test levels are coming down. More importantly, symptoms are improving. Yeah, so right now, I guess the first step is to increase awareness. Right? People don't know. And as a matter of fact, even in the functional medicine community, I realized when I started talking to people about this, I realized that most practitioners are not testing for heavy metals. Unless the client comes with, let's say, cardiovascular issues and all, but otherwise they're not testing.
I mean, even with cardiovascular issues, again, testing, when you talk about testing, the ease of availability, the ease of sending the samples, the ability to do it in India. Till recently, of course, now some of the tests are available in India, but still, it still has to go to Germany and Europe and USA for most of these tests. What we are after, cost is always a huge factor in when you're deciding should you test or should you make a diagnosis and then start treating.
Correct. Yes. No, that is true, sir. So what I realized was that I realized I need to get a estimation whether this person has high levels or not.
Yes.
Right. And I found that actually a simple blood test is giving me that. Right. See, there are a lot of different thoughts about which type of test is the right test for heavy metals. So somebody will say blood is not the right place because either it will tell you the recent exposure, what has been absorbed recently, or it's like a spillover from deeper tissues, right? Whichever way, it tells me whether this person has a need for treatment in that direction or not.
Absolutely. And that is what we want to know.
Correct.
Exactly.
So the exact number, in my approach at least, is not so important. So I'm working with blood tests, and where needed, we use a hair sample.
Okay.
Which we send outside India. Yes, you are right about that.
In terms of detoxification process itself, we talked about liver and we talked about gut and things. Is there anything else you would like to add?
So detoxification can be done in many ways at many levels, depending on the symptoms being presented, depending upon the age, the severity of the disease, the load of the toxins, right? So when we do it, we start with, see, especially when it comes to heavy metal detoxification, you need to prepare the body, right? Otherwise, you can actually, aggravate many conditions, because what the process will do is toxins which your body had tried to hide away in deeper tissues, in the bone or fat tissue, etc. Now you are pulling it out. Pulling it out, there is a process which makes it more polar, which means it becomes more reactive, right? So essentially, the damage that the toxin was doing can increase unless the body is prepared to handle it, right? So therefore, you have to work on the detoxification channels. You have to clean up the liver first. Make sure that the gut is functioning well. There is no constipation, motility is there, and even before you introduce any chelation, you should first introduce binders. And generally, a wide spectrum binder is better. So that kind of preparation is very, very essential. And also, chelation tends to be a heavy nutrient demand on the body.
It depletes the nutrients. You have to supplement again.
Correct. So depletion is more considered in terms of minerals, right? But the chemical reactions that are needed for the detoxification process will also require many other things, like glutathione, for example.
Oh, yes.
Right? B vitamins, like example. Your methylation must be happening properly, for example. So all of those bits and pieces have to be in place if you have to do this properly.
Interlinked. Yes. Excellent. So I think that's been a very informative session, Siddharth. Thank you very much for your time today. And we hope to do such sessions with you more in the future.
Thank you so much. It was wonderful, sir, of you to have me here, and we look forward to future interactions.
All right. Thank you.